reference in the paper totally obliterate that myth.
Completely.
The numbers do not lie, and they are stark. People are remaining highly sexually active well into their 7th and 8th decades of life.
And the patients at these clinics prove that.
Exactly. The older patients walking into these Baltimore clinics were not anomalies. They were reporting a full spectrum of sexual behaviors. They were engaging in genital sex, anal sex, oral sex. Many of them were reporting multiple partners.
Yeah, the multiple partners thing really stood out to me.
If you look at the study's data specifically on the patients over 50, a highly significant portion reported having 2 or more different sexual partners in just the 6 months prior to walking into the clinic.
The Hopkins team broke this down beautifully in Table 1 of their paper. I want to look at those numbers because they're wild.
Let's hear them.
For the patients over 50, 82.6% of the men and 79.5% of the women reported engaging in genital sex. That is the vast majority.
The vast majority.
Furthermore, 24.7% of the men and 21.4% of the women reported engaging in oral sex. They are sexually active, and because they are in an STD clinic, we know they are actively seeking care.
Right.
But the behaviors that accompany that sexual activity, the choices they are making behind closed doors, are where the real alarm bells start to ring.
Because the clinical data on what infections they have is downstream from their behavior. If we want to understand the infections, we have to examine the behavioral choices first.
Okay, so what was the biggest behavioral difference?
The most glaring difference between the younger cohort and the older cohort is what we can call the condom gap.
Yes. This was the single most shocking behavioral data point for me.
It's pretty dramatic.
When you look at the patients under 50, about 24.1% reported that they never use condoms. Now, obviously, from a public health standpoint, having a quarter of your young population completely avoiding barrier protection is bad enough.
It's not great.
No. But then you look at the patients 50 and older. A staggering 32.6% reported never using condoms. Over a third of the older demographic is just completely foregoing any form of barrier protection.
And we also need to look at the other end of the spectrum to get the full picture here.
The people who do use them.
Right. When they looked at patients who reported always using condoms, which remember is the only behavior that effectively stops transmission, the numbers were incredibly low across the board.
Really low.
Only 13.7% of younger patients and 12.5% of older patients reported always using them. But that jump in the never category for older patients is highly statistically significant. It shows a definitive behavioral trend.
How did it break down by gender?
Older men were the least likely of all groups to use condoms, with 29.5% saying never, and older women were astonishingly high, with 40.3% saying they never use them.
40%? I was trying to wrap my head around this. Like, why would someone who has lived longer, who arguably has more life experience and wisdom, take more risks?
It seems counterintuitive.
It totally does. I think about it like wearing seatbelts, or maybe a better analogy is sunscreen.
Sunscreen is a great comparison.
Right. If you are a younger person growing up in the 1990s or the 2000s, the concept of wearing sunscreen every single time you go to the beach was just drilled into your head.
Oh, yeah.
There are public health campaigns, your parents slathered it on you, schools talked about the ozone layer. It's just a fundamental part of going outside.
It's automatic.
But for an older generation, they grew up in an era of slathering on baby oil and baking in the sun for hours with a reflective visor.
Right, totally different mindset.
Their risk calculation was totally different in their formative years. So my question is this lack of condom use just a deeply ingrained generational habit? Or is there a completely different biological calculus happening here?
Well, it is a complex intersection of historical context and biological reality. You really have to put yourself in the shoes of the over 50 demographic in this specific study, which covers data up to 2010.
Okay, so people born in the 50s or earlier.
Exactly. These are individuals born in the 1950s or earlier. They came of age sexually during a very specific window of history. During their formative years, the primary overriding fear associated with unprotected sex was unwanted pregnancy.
Right.
The introduction and widespread availability of the birth control pill in the 1960s fundamentally severed the link between sex and pregnancy for many people. It ushered in an era of sexual liberation where condoms were largely viewed as, well, an obsolete, intrusive technology of the past.
And that timing is crucial, isn't it?
Very crucial.
Because HIV, the virus that completely terrified the world into using condoms, didn't hit the public consciousness in a major way until the 1980s.
Exactly.
By the time those massive urgent public health campaigns were launched, many of these older individuals were already settled into long-term monogamous marriages. They were completely bypassed by the intense wear a condom or die messaging that fundamentally defined the sex education of the younger generations.
That is exactly the blind spot.
Mhm.
And now, fast forward a few decades, due to divorce, widowhood, or simply shifting relationship dynamics, a massive wave of these older adults are re-entering the dating pool.
Right, they're single again.
And biologically, the threat of pregnancy is completely off the table because of menopause.
Oh, true.
To add another layer, the advent of erectile dysfunction drugs has revolutionized sexual longevity. This study specifically notes that PDE5 inhibitors, drugs like Viagra or Cialis, were used significantly more by the older men at 2.2% compared to just 0.3% in younger men.
So they have the capability.
So you have a population with renewed sexual capability, no fear of pregnancy, and a historical disconnect from the necessity of condoms. In their minds, the primary historical reason for a condom is just gone. They simply haven't internalized the threat of STIs because they were never the target audience for those warnings.
The consequences of that missing risk calculus are devastating, though. Let's look at the HIV implications specifically, because this is where a lack of education turns lethal.
Yes, the HIV data is very sobering.
The study points out a statistic that literally stopped me in my tracks. In 2013, an estimated 21% of all new HIV infections in the United States were among patients aged 50 and over.
1 in 5.
1 in 5 new HIV cases is a senior citizen.
That statistic is the grim reality of the condom gap. And the reason we need to focus on this is because acquiring HIV at age 60 is a vastly different and far more dangerous biological event than acquiring it at age 20.
Walk us through the biology of that. Why is it so much worse for an older patient?
It comes down to immunossenescence, which is the natural gradual deterioration of the immune system as we age. Okay,
Yeah.
when older patients contract HIV, they are routinely diagnosed much later in the course of the disease. The virus is allowed to replicate unchecked for longer,
Why is it caught so late?
because neither the patient nor their primary care doctor suspects HIV.
Ah, right.
When a 65-year-old complains of fatigue, mild cognitive changes, or unexplained weight loss, the doctor thinks, well, you're getting older. It might be depression or early dementia or just a slow metabolism. The thought of an acute viral retrovirus doesn't even cross their mind.
So by the time someone finally decides to, run an HIV panel, the virus has been systematically destroying their immune system for years?
Correct. When they finally receive a diagnosis, they present with significantly lower CD4 counts.
What are CD4 counts?
CD4 cells are the specific white blood cells that orchestrate your immune response, and they are the exact cells that the HIV virus targets, infects, and destroys.
Oh, wow.
So a low CD4 count means the immune system is severely compromised. Furthermore, older bodies just do not bounce back as well when placed on aggressive antiretroviral therapy. The liver and kidneys process the medications differently, and perhaps most dangerously, older patients struggle far more with concomitant comorbidities.
Meaning they already have other health problems.
Exactly. Imagine trying to manage a complex, aggressive HIV infection on top of pre-existing type 2 diabetes, cardiovascular disease, hypertension, or osteoporosis.
That sounds like a nightmare.
It is. The pharmacological interactions between the HIV drugs and their heart medications become incredibly complex and dangerous to manage.
And there is a truly terrifying biological mechanism that links bacterial infections back to the viral ones, isn't there?
Yes, there is a direct link.
The study highlights that acquiring other STIs, like syphilis, gonorrhea, or herpes, biologically increases your risk of acquiring and transmitting HIV. How does that actually work at a cellular level?
Well, it's a matter of creating a physical and cellular vulnerability. Let's say an older adult contracts syphilis, which causes an open sore or chancre on the genitals.
Right.
Or they contract chlamydia, which causes massive microscopic inflammation of the mucosal tissues. When tissue is inflamed, the body rushes immune cells to the area to fight the infection. Which cells does it rush to the front lines? CD4 T cells.
The exact cells HIV wants to attack.
Precisely.
Ah.
I mean, that is the exact mechanism.
Yeah.
By having an untreated bacterial STI, you are literally gathering the exact cells HIV needs to replicate and placing them right at the mucosal surface where exposure happens.
That is horrifying.
You are providing a massive open doorway for the virus. Oh. So this condom gap in the over 50 crowd isn't just about the temporary inconvenience of a curable bacterial infection. It is a direct biological pipeline to a fatal incurable viral infection.
Okay, the ongoing sexual activity, the lack of barrier protection, the physiological vulnerabilities. It all leads directly to the clinical realities the Hopkins team observed when these patients finally walked through the clinic doors. So we know the behavior. Now we have to ask. When an older patient actually sits on the exam table, what are the doctors finding compared to when a younger patient walks in?
To answer that, we really have to look at the specific disease profiles the study generated. The researchers broke down the statistics by age, sex, and the specific STIs. And the baseline findings, while lower than the younger group, are still incredibly high for a population we assume is not at risk.
Let's start with the baseline prevalence.
The researchers looked at the overall prevalence of what they classified as acute STIs.
Which means what exactly?
For the purposes of this specific study, in men, that definition included gonorrhea, chlamydia, non-gonococcal urethritis, which is an inflammation of the urethra usually caused by bacteria other than gonorrhea, and early-stage syphilis.
Okay, and for women?
For women, the acute definition included gonorrhea, trichomoniasis, and early syphilis.
Got it.
When the younger patients under 50 walked into these Baltimore clinics, the overall prevalence of having at least one of those acute STIs was 25.8%. More than 1 in 4 younger patients walked out with a diagnosis.
Which is a massive burden on the clinic. But what about the older cohort?
When you look at the patients 50 and older, the overall prevalence of acute STIs was 18.1%.
Nearly 1 in 5.
Exactly. Now, statistically, yes, 18.1% is lower than 25.8%. But in the context of public health, 18.1% is a highly significant, massive rate of active infection for a demographic that society treats as sexually inactive. 1 out of every 5 older adults walking through those doors had an active transmissible infection.
But treating them as one giant group kind of hides the really fascinating demographic splits. We need to unpack the granular data here because comparing the specific diseases reveals a very complex biological and sociological map.
It definitely does.
Let's start with gonorrhea. The study shows that younger men are highly impacted by genital gonorrhea. 9.2% of the younger men walking in had it compared to 4.1% of the older men.
So the rate drops by more than half for older men.
Right. And the drop-off is even steeper for women. 4.5% of young women were diagnosed with gonorrhea, dropping all the way down to just 0.4% in older women. What drives that massive decline?
Well, gonorrhea is an incredibly robust, highly transmissible bacterial infection. It is also often highly symptomatic, especially in men. It causes severe burning during urination and thick, purulent discharge.
So people know they have it.
Because it hurts so much, it drives men to the clinic relatively quickly. The much higher rates in the younger populations usually reflect tighter, more active, and more dense sexual networks with much higher rates of partner exchange. The pathogen moves quickly through a dense network.
And the drop in older women, from 4.5% to almost 0.
The steep drop in older women is very notable. It likely reflects 2 things. First, different network dynamics. Older women may have fewer concurrent partners than younger women in this specific urban demographic.
Okay, that makes sense.
But secondly, and crucially, there are changes in the biological susceptibility of the reproductive tract post-menopause. The cellular architecture of the cervix changes, which may make it physically harder for the specific gonorrhea bacteria and Neisseria gonorrhea to adhere and establish an infection compared to younger cervical tissue.
But the biological changes of aging don't protect against everything. In fact, for some diseases, aging seems to roll out the red carpet.
Oh, absolutely.
Let's talk about trichomoniasis, often just called trich. This is a parasitic infection. Here's where it gets really interesting. If you look at the women in the study, there's a complete reversal of the trend we just saw with gonorrhea.
Right, it flips completely.
Younger women had a trichomoniasis diagnosis rate of 13.1%. But older women, they were significantly more likely to be diagnosed, jumping up to an astounding 21.5%. Over 1 in 5 older women walking into that clinic had this parasite.
That 21.5% is a critical, highly concerning finding. Trichomoniasis behaves very differently than bacterial infections. It's caused by a microscopic protozoan parasite called Trichomonas vaginalis. While it can cause very uncomfortable symptoms like itching, burning, and a frothy discharge, it is very frequently completely asymptomatic, particularly in older women, or the symptoms are so mild they're dismissed as just a minor irritation.
Why does it spike so drastically in older women, though?
The fact that over 20% of older women had it compared to 13% of younger women, points to two leading theories. First, because it's so often asymptomatic, that 21.5% might simply represent persistent untreated infections that have lingered in these women for years or even to decades without them knowing.
The parasite just sets up camp and stays.
Exactly. Second, we have to look at the vaginal environment. The vagina has a natural microbiome, largely governed by lactobacilli, which produces lactic acid and keeps the pH low, which is hostile to invaders.
A defense mechanism.
Right.
Right.
But after menopause, as estrogen drops, that microbiome shifts. The pH level rises, becoming less acidic. There is strong evidence suggesting that this less acidic postmenopausal environment creates a much more hospitable landscape for this specific protozoan